This is my audience. This is Brittany McCune, and this is my informative speech. I'm sure many of you have never imagined yourselves getting struck with a sudden illness and needing an organ transplant. But the truth is that it can happen to any one of us at any time, and you would be really grateful to the brilliant surgeons who industrialized the field of medicine in organ transplantation. Today we're going to look at 3 turning points in the medical field of organ transplantation, including the first kidney, lung, and heart transplant in the United States. In the 1950s, organ transplantation was used only as a last resort to save the lives of patients who were terminally ill and had no other options, because usually they would make a small amount of recovery in the beginning but would eventually succumb to death because of rejection when their body identified the organ as a foreign body and attacked it. However, on December 23, 1954, at the Peter Ben Brigham Hospital in Boston, Massachusetts, Dr. Joseph Murray and Dr. David Hume performed the first ever successful organ transplant. Their patient was Richard Herrick, and the donor was his identical twin brother Ronald. They had the same DNA, which meant that his body wouldn't reject the organ. And since the majority of people are born with 2 kidneys, you can successfully remove one and they can still function with 1 kidney. Because of this surgery, there were about 10,000 kidney transplants that happened between 1954 and 1973. And in 2008 alone, there were over 14,000 in the U.S. In 1963, Dr. James Hardy performed the first lung transplant at the University of Mississippi Medical Center in Jackson, Mississippi. Since every person needs lungs to live, the donor has to be deceased. But the patient that they used to perform the first surgery had very diminished lung capacity, and before surgery, he had only 87% of blood oxygen concentration, but after surgery, his climbed to 98%, and ideally for healthy individuals, they want it to be at 100%. So then they had to wait and see how his immune system would respond to the organ. After 18 days, unfortunately, he passed away. But upon autopsy, it was shown that he died of complications to other health factors and showed no signs of rejection to the organ. This gave hope to the future of this surgery by proving that it was possible for this to be done and allow the organ in the new body to function physiologically normal. In the 1980s, a drug called cyclosporin was introduced and was an immunosuppressant that prevented rejection. With immunosuppressants, it started a new chapter in organ transplantation because it allowed for more transplants with less rejection. Thanks to these surgeons, in 2008, almost 1,000 lungs were transplanted in the United States. The heart, however, is a much more complicated organ, and so this transplant seems much more unlikely. But Dr. Norman Shumway, also known as the father of heart transplantation, made history at Stanford University in California when he performed the first one in the United States only days after the very first transplant took place by Dr. Christian Barnard in Cape Town, South Africa. His patient lived only 14 days, but it did give them hope for the potential of this surgery. According to Dr. Bruce Reitz, the former chair of the Norman E. Sherman Professor of Cardiothoracic Surgery Department at Stanford, many other surgeons gave up when they thought it was too difficult. But Dr. Sherman had persistence and vision that it would work. His determination is what made heart transplantation possible. Dr. Shumway's department did almost 1,250 heart transplants before he died in 2007. Now, organ transplantation isn't just giving up your organs. It's giving the opportunity to dozens of other people to have a second chance at life. It gives them another opportunity to make a difference in this world. The surgeons in this medical field made a big difference. If it wasn't for Dr. Murray and Dr. Hume with the first kidney transplant, over 915,000 people would have died. Dr. Hardy with the first lung transplant has saved over 104,000 lives, and Dr. Shumway paved the way for over 118,000 lives to be saved. These surgeons transformed medicine in America, and if you ever need a lung or a kidney or a heart or any other organ, it's made possible now because of their work. and you could have a second